Hi, my name is Alyssa Stangalini. This is my baby, Bradley Stangalini. He's a week old today. Last week, I went into labor with Bradley. That's when I was having significant labor pains. It wasn't long before the nurses realized that Bradley's heart rate was not recovering after every contraction. They were trying to get a hold of my provider to ask what their next step should be.
I'm George Alkhouri, Dr. Alkhouri. I work in Golden Valley Health Center. I've been in this center almost for 13 years, and my job is I'm a specialist in obstetric gynecology. On July 2nd, I received a call from the nurse in the hospital. Their patient came in, she's a term, she's in labor. The baby heartbeat keep dropping down. We need to do stab delivery for her. I review the strip from my home and I agree with the nurse with her finding, and I told her to take the patient immediately to the surgery.
I got rushed to the operating room. I wasn't able to get an epidural until Dr. Alkhouri got there. It was just a lot of pain that I was enduring, and luckily there was a lot of staff with me, supporting me and telling me I could get through it.
I took off from my home and I drove the car. I was going on the northbound. Then suddenly there a car came from the southbound. She came just toward me. I was so lucky there was no tree, nothing. I took my right side as much as I can, but she ended up hitting my side, and all those glasses just splitted on my face, on my arm, and my body. I see the hospital calling me like every almost 3-4 seconds, and I know there's an emergency case. My phone stopped working completely. The police officer came in, and I reached the charge nurse. I said, try to find any doctor if they can help. Until I'll promise you, I'll try my best to be there. And the police officer, he felt the emergency and urgency. He offered his help and he allowed me and released me to be going to the hospital and try to save that baby.
The anesthesiologist gave me the epidural, so I knew someone was coming, but I didn't know who.
I didn't look at myself at that point, if I was bleeding or not bleeding, I have injury or not injury. All my thinking, all my adrenaline about the mom and the baby. I did the surgery 15-20 minutes, then I came out. I noticed all my body hurting, my leg, my arm, my neck. But the scary part, when I removed the mask and I found all this blood on the mask, nurses came in and they helped me out to clean the blood, take the pieces of the glasses from my face and clean the blood.
They carried my baby over to where I could see him, and his face was very bruised and swollen. The situation, I'm learning more and more how serious it was. Not only was Bradley in such a position that it was impossible for him to be born vaginally, but also that his umbilical cord was wrapped around his neck 3 times. The staff that took care of me in recovery was amazing. It was even hard to leave because they did such a good job. Fortunately, he's perfectly healthy, and I just thank God for that.